welcome to Eye Contact. I'm Cédric Schweitzer. Today we are talking to Dr. Miguel Teus about minimally invasive glaucoma surgery, or MIGS. So welcome, Dr. Teus. Glaucoma patients can undergo a sequence of treatment options starting with drops, then laser, then filtration surgery. Where does MIGS fit into this pattern?
Well, in my mind, MIGS surgery fits in this pattern most probably when medical therapy becomes complex and maybe poorly tolerated by the patient, then a safe surgery such as MIGS may play a role. So I think that MIGS should be performed or should be considered between medical therapy and classic filtering surgery. So it's the way to make our patients tolerate better the medical therapy that quite usually they don't tolerate quite well. So I think that MIGS as a safe procedure can make surgery to be performed earlier during the course of the disease.
Okay. There are many MIGS options. Where are we now with the technology?
Well, I think that regarding the suprachoroidal options, we are still waiting for an implant safe enough to be used, to be available for widespread use. Regarding the trabecular measure pathway, so the canal stenting or whatever you want to call it, we have the iStent inject, which is quite easy to be used, two implants in the same carrier, and has proven to be safe and effective at least 2-3 years after surgery. So I think that nowadays trabecular MIGS are quite advanced. And also I would like to mention that subconjunctival shunting via ab interno way, the Shen implant, the Shen shunt, is also quite advanced. So I would say that nowadays subconjunctival filtration without being invasive, using an ab interno approach, and also the trabecular stenting, the trabecular shunt, are the two more advanced ways.
Okay. How do MIGS and cataract surgery intersect? Are you doing MIGS in phakic patients?
Well, I think that cataract surgery is the ideal scenario for a MIGS procedure, because once you are there, once you have the incisions being made, and after the cataract has been removed, there is I cannot see many reasons for why not to put a MIGS implant then, because you are not going to make any incision, any additional incision, a little more time consuming that simply a cataract surgery. You get a safer post-op in terms of IOP spikes if you use a MIGS. So I think that MIGS, they are really a huge advance in when a cataract appears in a mild to moderate glaucoma patient. But in addition to that, MIGS are beginning to be used as a solo approach, as a standalone procedure, especially in cases where the safety profile of surgery is appreciated. I can imagine a couple of clinical scenarios. Let's say patients with increased episcleral venous pressure, such as patients with carotid cavernous fistulas, etc., in which traditional filtering surgery may have a not safe profile. Then MIGS surgery can do a good job. And also, in some peculiar glaucomas in which the cause of the glaucoma is transient, for instance, steroid glaucoma or uveitic glaucoma, in those cases, you just need to control the IOP for some weeks. So in these cases, being able to control the intraocular pressure with a surgical procedure which is safe and avoiding spoiling the conjunctiva for future filtering surgery, conventional filtering surgery, if needed. They are very nice characteristics of MIGS.
Okay. Finally, which patient should not be considered for MIGS?
Well, I think that patients with advanced glaucoma in which very low intraocular pressure is needed to these patients, unless there is no other surgical option, there is always a scenario, such as patients with a lot of surgeries done previously, but patients with advanced glaucoma are really not good candidates for MIGS, because for most of them, and in the majority of the cases, you're not going to get the IOP in the low teens, which is what you really want to control these cases.
Okay, so thank you very much.
My pleasure.
For more information on these and related topics, please visit us at eurotimes.org.